Hi, everyone, and welcome to Doc's Thoughts. Today, I'm going to spend some time talking about your adrenal glands and cortisol. Part of the reason why is because I see patients every single day who struggle with their cortisol levels, chronic fatigue, feeling really tired and wired all the time. And a lot of people just simply ask me, I think my adrenals are out of whack. Can you do some testing? Can you help me figure out what's going on? So I want to really talk about your adrenal glands, cortisol, what they are, what they do, how you might know if you have an issue with them. And then lastly, I will finish the episode talking about what you can do about it if you feel like your cortisol and your adrenal glands are out of whack. In medical school, I learned about the adrenal glands and I learned about cortisol, but we really only learned it about them from a disease standpoint. So that's things like Cushing's disease, where your body makes too much cortisol, and that's a disease where you need specific medications and treatments, or Addison's disease where you don't make enough cortisol. Those are not the things I'm talking about. I'm talking about subtle changes in your cortisol that really aren't labeled as medical diseases, but they can definitely have profound effects on you and your symptoms and how you feel. I also, like I said, see a lot of patients who struggle with this. Some of the symptoms they experience are, like I said, they can feel tired but wired at the same time. So you've probably had that feeling where you feel absolutely exhausted, but your brain is just racing, or your body's just surging with energy, but you're also tired at the same time. Or some people are just like chronically fatigued and they wake up, they feel tired. They're tired all day. They sleep tons of hours. Those are all symptoms that can stem from cortisol irregularities. But again, they're not labeled as medical diagnosis. The other thing I want to put out there as a disclaimer is that it's never one system in isolation. So a lot of people will follow someone on social media or they'll take a course online and it's all about fixing their adrenal glands. And it's never just your adrenal glands. If you have Addison's disease or Cushing's disease, that's totally different. You have a diseased adrenal gland that just really isn't working the way it's supposed to. When we're talking about adrenal fatigue or cortisol imbalances, these are subtle changes that are linked to so many other systems in your body. So they're linked to your stress levels. They're linked to your level of sleep. They might be linked to an infection that you have. And so it's a really, really different way of treating it. It's not just about treating the adrenal glands. It's about looking at the whole patient, which is what we do in integrative and functional medicine. And so it's really important that you don't deep dive into just fixing your adrenals, because you have to look at your hormones. You have to look at your gut. You have to look at your vitamin levels. You have to look at what you're eating. You have to look at the whole picture. And so I really want to stress that no one should just say, I'm going to fix my adrenals and I'm going to be great. There's always something else going on. But looking at your adrenals is really important. And I'm going to talk about a little bit of the sciencey stuff first so that you understand what they are. And then we'll dig into what symptoms you might experience if your adrenals are out of whack. And then lastly, I'll finish with what you can do if you want to start working on them a little bit in combination with other things. So to start with, I want to talk about what the endocrine system is, because the endocrine system is a system that kind of houses or contains your adrenal glands. And it's basically a system in your body that contains all of the glands that function in your body. So glands are organs in your body that secrete hormones, which are like tiny messengers that do jobs. So your testicles are, if you have testicles, are glands. They secrete testosterone. Your ovaries, if you have them, are glands. They secrete things like estrogen, progesterone, and some testosterone. And there are many other in the body. Thyroid is a gland that secretes thyroid hormone. So the adrenal glands are like that. And these glands are all over in our body in specific places. And like I said, they secrete hormones that have specific functions. The adrenal glands specifically are located right on top of your kidneys. So they're kind of near your back. And they release many hormones, but specifically today I'm talking about cortisol, but they also release epinephrine. They release some sex hormones. But like I said, today we're just going to focus on cortisol. The other ones are also important and they're all connected too. So just like I said, you can't always just look at one organ and try to fix that. And then how are they regulated? So they're regulated through this system. So most of our glands are controlled by this chain of command, I call it. In the case of the adrenal glands, you have your hypothalamus, which sends message to your pituitary gland, which then sends message to your adrenals, and then the adrenals release a hormone. The other beautiful thing about the endocrine system is there's this thing called negative feedback. If you're someone who has thyroid disease, you understand what this means, because negative feedback basically means that this hormone in your body produces a negative feedback to your brain so that your brain knows not to keep making more of the hormone. So like if you have thyroid disease and your TSH, or your thyroid stimulating hormone, is high, it actually means that your overall thyroid levels in your body are low. So that's why it's called negative feedback. It's kind of like an opposite thing. So it's very beautifully controlled. And in terms of cortisol, like I said, the hypothalamus tells the pituitary to tell the adrenals to make cortisol. And then what is cortisol important for? So this is just a small number of things it's important for. There's many more, but specifically what I see with patients most of the time is it's really important for metabolism, which is important for either gaining weight or losing weight if you need to lose weight. Really, really important for energy production. So there's a reason why we feel nice and chipper in the morning when we first wake up, and that's largely due to cortisol production, which surges when you first wake up in the morning. It's important for something called gluconeogenesis, which is the formation of glucose from non-carbohydrate sources. So if you need quick energy in the form of glucose, cortisol will help your body kind of pull that together for you. It's really important for your stress response. So we are obviously always exposed to different types of stressors and different levels of stressors. So that cortisol helps you kind of manage those stressors and deal with them as appropriate. And you can see why if you have too much cortisol or chronically high levels of cortisol or too much stress, that can kind of be a bad cascade. Cortisol is an anti-inflammatory. So if you've heard of the drug prednisone, we often use prednisone for inflammatory conditions. And cortisol is kind of like your body's natural prednisone. So it's really good for bringing down inflammation and kind of simmering down your immune system so that it doesn't run crazy. Cortisol affects blood pressure regulation, and I already mentioned the circadian rhythm, but cortisol kind of drives your circadian rhythm, which is that beautiful rhythm we all have where, like I said, you wake up in the morning, you feel nice and chipper, and then by evening, you're kind of tired and cold and you want to go to bed. I thought about cortisol a lot when I was an ER doctor because in the middle of the night when you're working a night shift, you're freezing, you're hungry, you're like exhausted, and a lot of that is based on your cortisol because night shift workers are basically trying to live a daytime life in the middle of the night, and you can't force your body to change your cortisol production. So any of you who have pulled an all-nighter know what I'm talking about, that like kind of cold, tired, kind of wired feeling. A lot of that is cortisol driven. So how do you know if your adrenal glands are out of whack or working optimally? So there's lots of things you can do. You can get your adrenal glands tested. If you go to a regular doctor, they'll often just do one timed cortisol test. That's not super useful because your cortisol changes throughout the day and you really want to see what it's doing in a 24-hour or 12-hour cycle. But sometimes they'll just do a simple blood test. Cortisol is best actually tested with saliva. So if you're doing multiple tests throughout the day, it's best to get cortisol from a salivary test. At Wagner Integrative Health, most commonly we use a 4-spot cortisol test where you do it morning, noon, afternoon, and evening. There's also tests that will do more advanced cortisol testing where we test your cortisol in the evening hours. We test it multiple times when you wake up. That obviously gives you more data, but it can also be a really big pain in the butt for our patients. So often we tend to just do that 4-spot cortisol test. You can, like I said, test cortisol in the blood. And then if you're working with an endocrinologist, which is a specialist who deals with the endocrine system, oftentimes they'll do specific tests that kind of stress your body, and then they watch how your body responds. But that's really if you're getting more into the weeds and you think you have Cushing's disease or Addison's disease. So if you think you have imbalanced cortisol, you definitely don't need to see an endocrinologist. If you think that you have a full-blown adrenal disease, you definitely should work with an endocrinologist. And we refer out to endocrinologists all the time for things like that. But if you just feel like they're out of balance, these are some of the symptoms that you might experience. So fatigue is probably the biggest one. Like I said, cortisol is critical for energy. So if you are like exhausted all the time, you wake up, you just can't get your butt out of bed, you're dragging ass all day, let's just say it that way, it could be a sign that your cortisol is out of whack. On the other side of the coin, if you're just really like anxious and like edgy and your body feels kind of tired, but your mind feels wired, that also could be a sign of your cortisol being out of balance. And so energy levels, whether low or high, can be a sign of cortisol problems. Mental health issues is a big thing. So cortisol is really important for neurotransmitter production. High levels can lower your serotonin, which is really important for mood. It can also decrease the amount of dopamine, which is important for pleasure and reward. And then it can inhibit GABA, which is your calming neurotransmitter. So it can be associated with anxiety, depression, brain fog, mood swings. We all experience those things from time to time, but if it's a chronic, ongoing, low-level problem, there could be some cortisol things or cortisol problems involved with that. Sleep disturbances are huge. So people who have a hard time falling asleep, staying asleep, or oversleeping, that can very much be part of your cortisol production, whether you make too much or you don't make enough. So if you're having trouble falling asleep, or if you wake up throughout the night, oftentimes that's a sign that your cortisol levels are too high. And we'll see this when we test people. they'll have, kind of a flat curve throughout the day, but it remains high at nighttime. So you can imagine if you have this energy hormone that's surging through your body and then you're trying to lay down to sleep, it's going to be harder for that to happen. We also see women or men who in the middle of the night will just kind of have a cortisol spike. So sometimes instead of spiking when you're supposed to wake up, it'll spike a little bit earlier, and those people will wake up in the middle of the night, their heart is racing, their mind is racing, and it's 3 a.m, they can't get back to sleep. Oftentimes that's also connected to their sleep hygiene. It's also connected to their sex hormones. So it's never just cortisol by itself, but it's also something that very important to consider and something we can work on. A lot of people will actually notice some cardiovascular changes if they have cortisol issues. So cortisol is important for supporting your vascular tone, which is kind of what tightens your blood vessels and can keep your blood pressure at a certain level. So you can imagine if your cortisol is too high, you're going to start to have possibly high blood pressure. You might get palpitations because it can affect the sympathetic nervous system, which is responsible for your heart rate. Or you can actually have kind of a low blood pressure, which is going to affect your energy level as well. So it can definitely affect your cardiovascular system. Another symptom people might experience is frequent infections. So like I said, cortisol is kind of an immunosuppressive anti-inflammatory hormone. So good for certain situations. If you have an injury and you need it to calm down a little bit, cortisol can be really, really useful. But if you have chronically high cortisol levels from chronic stress or other reasons, it's going to suppress you too much. So you're going to have increased susceptibility to colds and flus and infections. And I would say you would even have increased susceptibility to cancer. So, they say stress is the number one killer. And I believe that the reason why we say that is because chronic stress causes chronically high cortisol levels, which will lead to all these things that can definitely affect your health and wellness. So the other thing to think about with cortisol levels is if you have poor recovery. So if you're someone who works out a lot, or if you're someone who's been injured and you feel like you're just not recovering as well, you have to look at your cortisol levels, because if you have chronically high cortisol levels, you're going to have more muscle and bone breakdown. You're going to have decreased protein synthesis, which you need to heal injuries. And you're just going to have that increased stress response, which is going to make you not recover as much from physical stressors. It can even affect your skin. So people who have slower wound healing, a lot of times it can be affected by their cortisol. Again, it's not always the only reason, but it can definitely affect how well they heal. Any of you who have been on topical steroids like triamcinolone cream or any of the other topical steroids will know that the doctor told you, please don't use this for more than 10 to 14 days because you actually start to get skin breakdown. Or people who have been on chronic prednisone orally will notice that their skin will start to get thinner. It will start to get affected. Their wounds don't heal as easily. They might bruise more easily. So it's definitely really important for muscles, bones, tissues, and things like that. This is a really big one. So I see a lot of patients for weight loss, and people always think calories in, calories out. I'm doing everything perfectly, but I cannot gain weight. And there are tons of things to think about, which is beyond the scope of this podcast. But cortisol is a huge driver in your ability to either not lose weight or lose weight. And this is how it works. So I always think of squirrels storing nuts for the winter. This is what I tell my patients. So if you are preparing for an emergency, or if you're really, really stressed, right? What are you going to do? You're going to shore up your reserves. You're going to store your nuts. You're going to kind of get things stored up. So then when that emergency comes, you have the resources to deal with it. That's how cortisol works. When you have chronically high cortisol levels, your body thinks that it needs more glucose, aka sugar. And so it's going to try to make more glucose, and it's going to try to store more glucose, often in the form of fat, so that when you have that emergency, or if you have that chronic low level emergency going on all the time, you have the energy you need for it. That type of thing leads to weight gain, especially around the midsection. You can get insulin resistance, prediabetes, diabetes, abnormal blood sugars, and it's this vicious cycle. And so a lot of times when I'm working on patients with weight loss, we use a multifaceted approach, but cortisol is one of the main things we look at, because if you have chronically high cortisol levels, it's going to be really, really hard to lose weight. So it's really important for weight loss. Other things it can affect are digestive issues. So it affects the motility and function of your bowels. It can change your absorption of fluids. So it can cause irritable bowel syndrome and diarrhea. That's been highly documented. And then lastly, it can affect your hormones. And that's kind of a yin and yang thing. So sex hormones affect cortisol. Cortisol affects sex hormones. So often people who have issues with their cortisol will have, if you're a woman, irregular menses. If you're a man, maybe low testosterone levels. We also definitely see a decrease in sex drive, because I always think, why would you want to have sex if you're expecting an emergency to happen? So if you're chronically stressed, or if you're having all these stressors hit you all the time, or if you just perceive them to be very stressful even when they're not, you're not going to want to reproduce. No one wants to make a baby when they're under a state of stress. That's very physiologic. So it's going to affect your sex drive, which I think is really important to know, because everyone wants a good sex drive. And so those are kind of the symptoms to think about. And I gave you just some examples of why it happens and which parts of the body it affects. So I know that was a lot, but I think it's really important to understand that if you think you have a cortisol issue, there are so many symptoms you could potentially have. And there's a reason for that. There's so many systems that are involved, and they're all connected, which is really, really important. Why it's really, really important to work with someone who looks at all of the different aspects, right? And then I want to talk a little bit about chronic stress and why it's affecting us so much. So, we could definitely say that people are experiencing stress at a much higher level than we used to. And therefore, we're seeing a lot more people who are experiencing cortisol imbalances and cortisol issues. So what used to trigger us, stressors that used to trigger us, back in the day, were natural disasters, tigers chasing us, dangerous situations. So really serious, stressful issues. The beautiful thing about those things, even though they're very stressful, is that they're episodic. And so you get hit with a stressor, your body surges, you release all this cortisol, and then the stressor goes away. And that your body does really well with that kind of a rhythm, because you can squirt out cortisol in these like small little amounts, and then you can come back to baseline and be normal. When in our life now, I call it the American life, we have just chronic daily stressors. We have, hundreds of emails that come into our inbox every day. We have traffic, we have loud noise, loud music, we have family stressors, we have kids to get to practice. Like there's literally stuff going on all the time. And even if it's stuff that you enjoy, it's a stressor on your body. And when that happens, you don't have time to kind of come back to baseline and then surge back up again. So you're just constantly having to deal with increased cortisol production to meet the demands of the stressors. We also have what I call perceived stressors. So perceived stressors are when there's a stressor that might not be that bad, but your brain perceives it to be an emergency. That happens a lot in people who have experienced significant trauma, whether it's really serious trauma or whether it was just like low-grade trauma for a large portion of their childhood or young adult life. That actually changes our brain so that when you get exposed to stress, your brain thinks it's a lot worse than it is because of what you experienced in the past. And so as I move into talking about how we can fix our cortisol, it's important to realize that part of it is definitely tied to our nervous system and our psychological system, and part of it might have to do with childhood trauma. So I just wanted to throw that in there. There are other things that can affect your cortisol as well beyond stress. So there's too many responsibilities that kind of goes in the stress pile. There's not enough rest or downtime. So one of the things I started doing recently, because I'm doing stuff all the time. I've got lots of stuff going on. It's all really good stuff, but I was starting to feel that little bit of level of stress that I didn't want. It was starting to affect my sleep. It's just kind of giving yourself permission to have rest and downtime. So now when I take my walk, instead of listening to a podcast and answering emails at the same time, I just shut it all down and I just walk and I look at the trees and I kind of let myself come down to a natural state of rest. The same is true for your days off. Instead of running around and trying to get all these things done, like let yourself sit in a chair, look out the window, drink a cup of coffee, cup of tea, hang out with your loved ones. So there's all these different things that you can do. And I'm kind of getting into what you can do to fix your cortisol. So I'll talk about this more later, but not enough rest and downtime is definitely a huge cause of cortisol imbalances. Poor diet and lack of exercise can affect your cortisol balance. So I always say, lifestyle is key. So if you're eating a shit diet and you're not moving your body, you're not sleeping, these things will all affect cortisol production in a very real way. So you have to kind of start at ground zero and work on those things first. And the rest are kind of you can layer on as you try to improve your cortisol balance. An interesting thing that can cause cortisol imbalances that I love to talk about is actually too much exercise. So obviously I'm a big fan of exercise and I want all my patients exercising, but the people who are doing like the endurance training, the Ironman, the ultra marathons, those are beautiful events, but sometimes if you're doing them too often, too much mileage, you're actually going to affect cortisol production. So I've taken care of a lot of athletes who have been endurance training for a long time, and then they just crash, and they crash hard. So it can be really hard to kind of build up that cortisol balance after you've gone through that. So you have to be careful with endurance training. environmental exposures and toxins can affect your cortisol balance. So things like caffeine, energy drinks, stimulants, obviously alcohol. If you're taking steroids, if you're a bodybuilder and you're taking illegal steroids, or if you're a patient who has a chronic illness who's taking steroids, that can affect your cortisol balance. Health conditions will affect your cortisol balance. So if you have a chronic health condition, that will definitely affect things. Infections can affect your cortisol. I already spoke about hormone changes causing changes in your cortisol, specifically the sex hormones. So those are just a quick list of all the things that can affect your cortisol. And now I'm starting to get overwhelmed just talking to you about this. So don't get overwhelmed by all this information because it's kind of simple at the end of the day. So I'm going to tie it together and talk about some things you can do, which is the most important part, to try to get your cortisol back into better balance. And you don't want to do all these things all at once. When I work with patients, I give them maybe 4 or 5 things they can choose from, and I tell them to choose 1 or 2. Start doing those things. We'll meet again. We'll see how you feel. Sometimes people respond really, really quickly and everything levels out. Sometimes it takes more work and effort, more testing on my part, more work on their part, but it just really depends on how much other things you have going on and how bad your imbalance is. But these are all things that you can kind of layer into your life. And like I said, start with 1 or 2, get really good at it, and then layer on another thing if you're not feeling good. First of all, I would say most important is looking at stress management. So I like thinking about the serenity prayer for this. So change what you can, accept what you can't, right? So look at your stress level, look at the stressors that are in your life, get rid of what you can in an appropriate timeline, and then deal with the things you cannot. And I'll talk about how we deal with stress as we move forward with this. So it's really, really important that you just do an assessment of your stress, your stressors, your friends, your work, your everything in your life that's causing you stress, and just cut out the things that you don't need anymore, because this is your life, this is your health, and it's really, really important. Look at your trauma history. So when I was talking about perceived stress and how old trauma can affect cortisol production, it's really important that you look at your trauma in your childhood. So I have patients all the time who I'll ask them about their trauma in their childhood, and they've never dug into it. They've never done work on it. They've never done counseling. So it's important to look at that and say, maybe I did have childhood trauma, and maybe it's affecting me more than I thought it was in the beginning. And if you do identify it, it's dealing with it. So I think therapy is great. I also love other things like brain spotting, EMDR, Reiki. So there's other forms of non-talking therapy that can kind of get into that subconscious space and help you heal from prior trauma that you necessarily don't need to just keep talking about all the time, because sometimes that doesn't work, and I totally understand that. And then adding relaxation techniques is key. So if you're someone who's feeling like their cortisol is out of whack, you can do things on a daily basis that will actually help your system get into better balance. It will also work really beautifully on your nervous system, which is highly connected to your adrenal system. So you've probably heard me talk about the sympathetic and parasympathetic nervous system, your fight or flight, rest and digest. So these things are very, very connected to your adrenals and cortisol production. So working on things that are relaxing or mindfulness type techniques will affect not only your nervous system, but they will highly affect your cortisol production. So things like meditation, I love breath work. I think things like yoga, Pilates, more restful type exercises, getting outside in nature, working on crafts or hobbies or things that you really enjoy, music. Those are all things that can kind of calm down your nervous system, which will then also calm down your adrenal system, either making more cortisol if you need it or less if you don't need it. And then working on time management. This kind of ties into the stress pile that I'm talking about. So I think it's really useful to literally take a week and every day write down everything you do and see how you're managing your time. Because if you're like me and you can get really scattered and you're trying to multitask, you're going to find that that's creating unnecessary stress on your body, where if you just broke it up into time blocks or you cut some stuff out, you're going to be able to feel more at ease and get more done and not have all that unneeded stress on your body. Then there's changes in lifestyle you can make. So I already touched on sleep and exercise and diet, but if you are not sleeping well, you're not going to have a normal cortisol balance. So sleep is critical, 7 to 9 hours a night. It should be restful sleep. I love my Aura Ring to show me how well I'm sleeping. So sleep is really important. Exercise, obviously really important. And again, not too excessively. So a lot of people who come to me who are having cortisol issues and they're doing these high intensity interval training exercises, I actually tell them to back off on that. Or people who are doing endurance trainings, or people who aren't exercising enough. So if you're not getting out and moving your body, either way, those will affect your cortisol levels. And then for your diet, you can go down so many rabbit holes with which diet is best for you. And so if you're following someone and they're all about your adrenal glands and they're like, you have to eat this specific diet, it's super strict, like that's just bullshit. Eat a healthy, whole foods, Mediterranean style diet. And if you need something more than that, you should work with a very experienced practitioner who can guide you down the right pathway regarding your diet. There's so many things out there, whether it's books or on social media or courses you can take that say this is the perfect diet for everyone. And there's nothing further from the truth. There is no perfect diet for everyone, but there is a perfect diet for most. And that's the anti-inflammatory Mediterranean style diet. So start with that. And if you need more, work with someone who knows what they're talking about. And then another thing I love for your adrenal glands and cortisol production are supplements. One thing about supplements is I look at supplements as like a temporary relief for your adrenal glands. So unless you have so many huge stressors in your life and you absolutely can't get rid of them, and that definitely happens to some people, whether they have someone who's ill in their family or a job that they know that they can't quit for a year, that would be maybe more long-term supplement use. But supplements really should be used just periodically for when you have stressors in your life that you can't deal with to kind of get you over the hump. Adaptogens are my favorite. So adaptogens are herbs that help to regulate cortisol production. They're called adaptogens because they're adaptable. So they can either decrease cortisol production if you don't need as much, or they can actually help you make more if you need more. So they're just beautiful compounds. They come in many forms. There's many blended products that are available. Often with our patients, we identify, what their cortisol issue is. Are you too high or are you too low? When their cortisol seems to be out of balance, whether it's morning, noon, and night, or it's just one time of the day. And then we can help them decide when they should use an adaptogen and which one they should use and for how long. And a lot of times my patients will use them for 3 to 6 months, and then we fix the other stuff that's going on, and then they don't need to use them anymore. Vitamins and minerals are also really important for your adrenal glands. So it's important that you get your levels checked, make sure you're taking a good multivitamin, multimineral, make sure your D is optimized, make sure you're on some magnesium. But again, you want to get your levels checked before you just start taking a bunch of supplements, because not everyone needs everything. And if you're like me and you have, a couple drawers full of supplements because you saw the next coolest thing on Instagram, or you took a course that told you about this awesome supplement, it can get really overwhelming. You can get what I call pill burden, where you're just taking excessive numbers of supplements every day, which is no fun. So just, try to be simple about it and get the information you need so you can decide which supplements to take. And then a couple more things for adrenal support, which I think are really important. Family and friends. So this is kind of part of the whole lifestyle thing. I put family and friends kind of in the same place as diet, exercise, sleep, etc. But having that social network to support you can very much support healthy cortisol production, because having a community, having support is going to decrease your stress. This is very well known. Loneliness is very stressful. So having that social support is going to help you with healthy cortisol production. And then lastly, biohacking. I'll talk a little bit about biohacking. So in my last podcast, I highlighted all the different types of biohacking that is out there, not all of it, but the ones that I am currently more well-versed in. But I do think that biohacking is really, really powerful for cortisol. Cold exposure, I've talked about at length, super healthy for cortisol production. I personally found when I was doing more regular cold plunging that my stress response was definitely diminished in a good way. So I wasn't reacting as much to stressors. I was dealing with my personal stressors much better. I was sleeping better. So definitely very powerful. Even something as simple as a 1-minute cold shower every day is extremely powerful. So I definitely recommend a cold exposure. Sauna is really good for cortisol balancing. Red light therapy can help with cortisol balancing. If you want to make it super simple, just get morning sun exposure. So when you go outside in the morning, even if it's cloudy, you get sun rays in your eyes, even if they're diffused through the clouds. It tells your brain that it's morning, and it tells your brain that it's time to make cortisol and it's time to suppress your melatonin, which is your sleep hormone. The opposite is true in the evening. If you keep your house dark and you don't expose yourself to lots of screens and blue light, your brain is going to start to make more melatonin, and your body will start to make less cortisol so that you're nice and sleepy and you can sleep through the night. So this was a lot to talk about, you guys, but I am seeing just patient after patient after patient who A, wants me to check their cortisol and thinks that their cortisol is out of whack, or B, definitely has adrenal and cortisol issues. And part of my reason for making this podcast was I can't teach a person in a 1-visit appointment how to fix their adrenals and how to improve their cortisol balance. I can't teach you in one single podcast how to do this. either. But one of the goals is to at least educate you on what your adrenals are, what cortisol is, what things are affecting them, what symptoms you might experience if your cortisol is out of whack. And then you can go on to do further education. You can choose to see a practitioner who can work with your adrenal glands, and you can start to do some of these simple things that I highlighted at the end of this podcast on a daily basis that could definitely help with your own cortisol balance. So, with that being said, I do have one last book that I would recommend that is all about the stress response. This is a book that I read back when I started my integrative medicine fellowship. So it's an oldie but a goodie. It's called Why Zebras Don't Get Ulcers. The author is Robert Sapolsky. It's Sapolsky. And as a Western trained medical doctor, it was one of the first books that gave me an aha moment about stress, your stress response. And it taught me a lot on how I can do certain things to decrease my over stressed response that I was having back when I was an ER doctor. So I would check it out. You can get it on Amazon. And if you have any comments or questions, I would love to hear them. If you have any feedback, I always love feedback. And definitely start thinking about your cortisol production, thinking about your energy levels. Ask yourself, could I possibly have a cortisol issue? And then do some of the things we talked about in the podcast to start getting yours in better balance. With that being said, I will talk to you soon and have an awesome day.